This video is brought to you by Matrix Dental Laboratory and Consulting. Tom Zaleski, dental technician and consultant. You can find me on the pages of Dental Lab Products magazine, on Facebook, or in LinkedIn. Today's presentation is about Versacryl. A secondary use for Versacryl, of course. The primary use for Versacryl is soft liners. But since we have the material laying around, let's find another use for it. That use would be making treatment provisionals, claspless treatment provisionals. Been making those for some time now with the material. In order to do so, I recommend the laboratory kit for the versatility's sake of rigidity. You can adjust the rigidity. With the reline kit, you only get one form of softness, whereas you can adjust the softness with the laboratory kit. The laboratory kit comes two ways, comes in the self-cure and heat-cure versions. I prefer the self-cure version for treatment provisionals. Expect with self-curing material to get about 12 to 14 months, which is, I feel, adequate enough time to provide a provisional, or under the guidelines of what a provisional would be. In your pamphlet, in the box, in the kit, you will find this chart. I just want to talk about this just for a second. 100% softener would be a stress breaker, and then you would go forward. A standard reline ratio would be 80-20, or 8 drops of softener to 2 drops of hardener. So this gives you a nice baseline for how you can figure out whether or not you want to make it harder or if you want to make it softer. So 90-10, of course, or 9 drops to 1 would be a bit more soft, and then of course 10 would be almost a rubber cement soft type, and the post dams would be rigid and would be only flexible under hot water. So it would be moldable, and once it cooled down to body temperature, it wouldn't be as soft because you would want to mold it into the post dam area using the material. We'll talk about that in another video. Anyways, here's your claspless treatment provisional. It comes two ways. You can either make the self-cure resin one, or you can make the surgical tray style. I prefer this one because of strength, and we'll first talk about the self-curing resin style. It's what I call the conventional self-cure style. It's layered Versacryl for undercut retention and a Diamond D self-cure on top. So I literally put the Versacryl into the undercuts first and then apply self-curing Diamond D resin over the top like we would with the sprinkle technique of a conventional type of fabrication. The first thing I do is sketch out where I'm going to put the Versacryl, and then I soak the model, generally about 10 minutes. I do this in lieu of using separator. I found that just soaking the model will prevent the Versacryl from sticking. As long as it's wet when you apply it, it won't stick. When we're talking about the hardener and softener liquids, one thing to keep in mind, especially when we're talking about undercuts, is that if we have big, large undercuts, we would like to have a little bit softer material so that it can pass under those undercuts without tearing. And then at the same time, if we have small undercuts, we're going to want to make it a little more stiffer, a little harder, so that it'll engage those undercuts readily and hold in place and not flex away. Again, refer to your chart in your book, and remember that 80-20 is your basic reline ratio, and that's where you would work from to either make it softer or harder. By the way, this photo here just shows you the consistency that I butter the Versacryl into the undercuts with. I'll take and place this in the undercuts and finger mold it in, and I'll show you that here in a second. One other thing to mention, however, is that when we're working with the hardener and softener liquids, is to never cross-contaminate the bottles and never use the same pipette for each. So when you get your kit, put an H on one pipette, put S on the other pipette. dedicate them solely to the hardener liquid, softener liquid. Do not use them with a monomer, hard monomer. Just because that's hardener liquid, don't use that with monomer. Use it only for the hardener liquid, only for the softener liquid. And when you package it up and put it in your drawer at the end of your technique, make sure you put each one in a baggie. You don't want it getting on anything, and you do not want to cross-contaminate other vials or other pipettes you might have for using for conventional acrylics. I made the mistake of using the hardener pipette for a conventional denture I fabricated and found the hard way that it will impart a soft surface on your denture, on your conventional denture acrylics. So again, do not cross-contaminate these. Don't use them for any other monomers. I can't stress that enough. It's probably one of the biggest things that happens in laboratories who call for technical help, is that they've used either a pipette that's used for conventional acrylic monomer, or they've cross-contaminated their liquids. And once you've cross-contaminated, you've got to throw them out and buy new liquids, and it is expensive. So keep that in mind. Okay, engage your undercuts. So what I do is mix up my Versacryl, get it to that honey consistency that I like, and then I adapt it to butter it on to the undercuts of the model I'm working on. It should be the consistency of honey, and when adapted to the cast, in order to slightly run in, it should be able to run in, and you fill your interproximal areas. And then what I do is I wet my finger and I mold it in before it stiffens. It takes a while yet to stiffen. You'll have time to work on it. But take it and work it in until you feel that it's adequately adapted, and finger mold it in. Then once it's finger molded, take a little bit of the hardener liquid on the end of a Q-tip and take and adapt it to your Versacryl. And I call that priming. So you'll prime your Versacryl with hardener liquid. Sprinkle, and then sprinkle adapt your Diamond D self-cure repair resin or preference, whatever you'd like to use, over the top of the Versacryl. So you're basically going to put a hard shell on top of the Versacryl. Don't overdo your Versacryl, because a bulk Versacryl, it just ends up being overly flexible. You just want to use it to engage the undercuts, and then you'll have a nice thickness of repair resin over the top of it, or self-curing resin, for strength. Try not to make it too thin, because you know Versacryl flex, and if it flexes, then the appliance will crack. Again, be judicious about the way you use the Versacryl, and again, use it only to engage the undercut. But again, make sure you cover the Versacryl with an adequate thickness of the self-curing resin for strength. Here's a diagram just to give you an idea. If the red was the Versacryl, and here's your height of contour, I try to engage my undercut just enough to the height of contour, and then when I lay the self-curing resin over the top, of course I'm taking into account the height of contour again, all the way down to the base. What this does here, this imparts a bit of stiffness at the height of contour, helps to keep it stable. It works really well in that regard. Then I'll cure it. Use a conventional pressure vessel, a warm water bath, 105 to 120 degrees. I tend to go towards 120. About 20 to 25 psi for about 20 minutes would be my recommendation for the product. And then once it's cured, I would take it out, and I would use mini Scotch-Brite wheels as a pre-pumice or a precondition, and then I would pumice it and polish it. In order to get the best finish, of course, always use a little cold water. If you do happen to get onto the Versacryl at all, or if you have any exposed Versacryl, you'll be able to polish the Versacryl if it's stiff, and the only way to stiffen the material is with cool water, and using cool water in your pumice. I call this your dual lamination effect, but one of the drawbacks, of course, with this or any of these types of treatment provisionals made with sprinkle acrylic is that the tongue area is extremely thick, and there's also the chance of breakage where you have these deep bites in the anterior region. I find that they usually like to break right there, and we're always servicing them. With that in mind, I switched over to using another product with the Versacryl in order to have a stronger appliance, one that won't break, one that's much thinner, and that version is the thermal form treatment provisional using PET, polyester terephthalate, which is commonly known as surgical tray material. I mentioned PET because we tend to use the surgical tray moniker as a generalized term, and you must make sure it's polyester terephthalate in order for the material to stick to it. Okay, so let's take a look at this. We'll duplicate our model first, the master, and we'll duplicate, and then we remove the parallel area and trim it up real nice in preparation for thermal forming. And again, we'll be thermal forming surgical tray material. Prior to our thermal forming, what I like to do is cut grooves in the bottom of the model in a cross-cut fashion, and what this does is increases the vacuum on the vacuum former. If you have the conventional vacuum former with the holes on the bottom, by putting these cross-cut diagonal cuts, we're connecting the dots on the bottom side of the platform to these channels, which will increase our vacuum around the periphery quite nicely, about 8 to 10%. I always like to thank Dan Michaels for that little tip. Dan is a technician for about 40 years in Indiana. He attends all the Indiana Midwest Spring Technical meetings. I call him the professor. He always likes to stop by and share stuff with me. He's a great guy. If you ever see Dan at one of the shows, I ought to go up to him and pick his brain because he's got tons of great ideas. So anyways, thanks to Dan for that tip. Here's our polyester terephthalate vacuum formed over the top of the duplicate. You'll notice sometimes we get a little crease there. What I'll do is, while it's vacuum forming, is I'll take a little instrument and I'll press that area down while it's still hot and vacuuming, and that will take that crease out. Especially if you have several teeth with a natural tooth in between, you'll tend to get these creases. So by using a little round instrument and pressing down on it, usually a waxing instrument handle is the way to take care of that. Press it down and then it'll be nice and smooth. But here you go. Here's the vacuum formed frame, I call it. And again, that is vacuum adapted 0.100 or 0.120 polyester terephthalate, available through Keystone Industries. And then what I'll do is I'll gross trim that framework on the master model. I use a little black marker. I want to etch it all, draw it all out first so that I can carve it back. And I'm starting to think about where I'm going to place my Versacryl, because I'm going to have to relieve that area of the frame so I can add Versacryl to it. So I'll gross trim and mark the areas, and then I'll scallop them away where the Versacryl undercuts are going to be, and those would be interproximally, of course, and below the height of contour of the linguals of these teeth. So I prepare that area, and you'll notice this goes all the way through the pontic area as one piece, so that fracturing situation that occurs with self-curing resin doesn't exist, because this is all one piece. You're going to be setting that tooth on top of that pontic area, and that aids in strengthening the entire appliance. Here's just a little view of that. You can see the pontic is covered. It's all one piece now that there's no fracturing, because this material is extremely tough. Here, let me show you a closer look of it. Here's a little closer look. You can see it fits the scallop very nicely, and the tooth I'll usually slot this, treat it, and place a tooth right on there. But again, the fracture is not coming from someplace along the connector, because of the fact that the connector and the saddle area is encompassed by the polyester terephthalate. Then once I've got the framework trimmed out and the areas figured out on where I'm going to add my Versacryl, you'll notice I have just a small platform in order to adapt the Versacryl. I'll first Scotch-Brite it. That's mini Scotch-Brite wheels available through Keystone Industries. Then I'll treat the area with Palabond, and then thirdly I'll treat the area with monomer. Now this is a misnomer. I should be saying hardener liquid, same thing as monomer, but it's the hardener monomer or the hardener liquid. That would be the third bonding agent that I would put on. So you're getting mechanical retention, and then you're getting chemical retention. Okay, this is a mild solvent, and so is this. So we're etching into that surface in order to get the Versacryl to stick nicely. And the amount of freestanding Versacryl will also affect the amount of rigidity. In other words, if we have a lot of area of freestanding Versacryl, it tends to be more flexible, so be very judicious about how much Versacryl you use in your undercuts, because if you have a lot of it, even if it is rigid, it'll still be flexible. You want to kind of control the flexibility and stiffness so that you're engaging the undercuts on the linguals, but at the same time you're able to free the appliance with a mild warming of the material with the patient swishing warm water in their mouth against it. So again, remember the amount of freestanding Versacryl will affect the amount of rigidity, and always prime the area accepting Versacryl with hardener liquid. Put it on the end of a Q-tip just before you start to adapt the Versacryl. Then once you, then you select the appropriate hardness. Again, I'll refer you back to the chart. It'll be in your booklet, in your kit. This is the consistency that you want of the Versacryl. It's like honey. And then I butter it in, get it in the position, and then finger adapt it from there. Wet my fingers and press it into the undercuts and up against the PET. And then again into the pressure pot, warm water bath, 105 to 120 degrees, someplace in there. 28 to 25 psi for about 20 minutes. And that will cure it adequately. And then what I'll do to pumice and polish this area that is Versacryl, I mentioned this earlier, I will use a chilled water, chilled pumice, and cold muslin buffs to reduce the frictional heat. And as long as you keep the Versacryl cold and stiff, it will polish just like standard acrylic will. So I get a nice polish on that. And I used pink, but they also have Versacryl in clear. You could use Versacryl in clear. I used pink because I wanted to be able to show you here in the example where the Versacryl was. I always add the tooth last. As you can see, it's all in place. Here's the nice thing: super thin in here, no tongue getting blocked for phonetics. Very thin in here, very comfortable appliance, and again, all one piece, all very strong. Here it is as another look of it. You can see the freestanding Versacryl. Well, actually, this is Versacryl through the appliance. You can see through the clear. So there's only just a little bit of Versacryl it's actually engaging. These are good for about a year, about 12 months. Here's another view of that same thing. Again, you can see how I've engaged all the undercuts. So, if you're interested in this application of Versacryl, or have never used Versacryl before, I suggest that you call Keystone Industries at 800-333-3131. If you have any questions, you can call there. They'll connect you to me. And they'll also, upon request, send you a free $90 sample. I do want to stress that it will be the self-cure, which is fine, but it'll be the Reline kit, which will be the 80-20% ratio, which would be adequate for most of these types of appliances, and of course always adequate for a Reline. And when you call, ask for Denise or Kathy. So again, just wanted to say thanks for stopping by. Take a look at what I had here on my YouTube videos. More to come in the future. I'm hoping to start coordinating some of the videos along with my articles that are showing up in Dental Lab Products magazine. Unfortunately, I only get about 1,000 words, and most of these topics entail much more dialogue, and I'm hoping to supplement that those articles with these types of videos. Again, thanks for stopping by. Hope to see you soon.